Welcome, everybody, to the Medical Center Show. I'm Joe Scott, President and CEO of Jersey City Medical Center, part of the RWJ Barnabas Healthcare System. Today, we're going to do a little bit of a year in review. I have with me two of my administrative staff, our new Chief Operating Officer, Michael Prilutsky, and Brenda Hall, our Senior Vice President for Safety and Quality. We're going to talk about all the great things that happened this year at Jersey City Medical Center and our plans for the future. We'll be right back.
The Jersey City Medical Center, you know it for its award-winning, life-saving ambulance service. It's also your health hub, with health and wellness locations staffed with certified professionals all through Hudson County. The Jersey City Medical Center, here to help you with your healthy, here when you need us the most. The Jersey City Medical Center. Visit us on the net to learn more. Jersey City Medical Center, Robert Wood Johnson, Barnabas Health Facility. Let's be healthy together.
Rama Jewelers, located in the Lyndhurst Shopping Center at 413 Valley Brook Avenue, Lyndhurst. Come for all your jeweler needs at Rama Jewelers, where you will find a fine selection of necklaces, earrings, rings, and bracelets. Choose from one of our complete sets, our many signature items, or find the perfect engagement ring. Come on down. That's Rama Jewelers at 413 Valley Brook Ave, Lyndhurst. Call 201-939-5784 or visit us online today.
Welcome back to the Medical Center Show. We're going to talk about some of our accomplishments last year and some of our plans for the future. With me is Michael Prilutsky, our new Chief Operating Officer, and Brenda Hall, our Senior Vice President for Safety and Quality. Brenda, let's talk about some of the great things that have happened under your leadership for safety and quality. So, Leapfrog. Tell everybody kind of what Leapfrog is and why it's important and kind of what we've been able to accomplish at the Medical Center.
Leapfrog is a rating administered by the Leapfrog Group, which is a conglomerate of industries and leaders in various industries that provides a measure of safety and quality. There are several different measures that are used to look at basically how safe a hospital is in terms of hospital-acquired conditions, such as infections.
Right.
How efficient we are in terms of length of stay, the readmission rates.
Right.
There are various measures that are used.
So let's talk about that for a minute. So do you think the general public knows that when you come into a hospital you're going to get an infection, right? So why are we measuring that? And there's a risk of that happening once you come into the hospital.
Absolutely, absolutely. And I don't think the public necessarily thinks about that and what can cause it and what the hospital is doing to prevent that.
Right.
And so that's why it's important that the public does become aware and they can make the right choice or the right selection of healthcare facilities to receive their care.
So this rating kind of helps them make that kind of choice.
Absolutely.
Right.
It's rated on a scale of A to failure, or F.
Right.
And generally, it's like a restaurant.
Right.
You go into a restaurant, you want a 4-star restaurant.
Sure.
And so if you go into a hospital, you want a safety-rated hospital.
Right. And so tell us a little bit about our results over the years.
So we have worked very hard to make sure individuals do not get hospital-acquired conditions. And we did that without focusing on a rating or without focusing on any type of reward.
Right.
We did it because it's the right thing to do. No one expects to get an infection in a hospital or have some condition. And so we've worked on that, and since the beginning of the Leapfrog rating score release in 2012, we've been able to achieve 10 consecutive A ratings.
Wow. How many hospitals in the country have done that?
At this point, with the fall 2016 release, it's only been 72 hospitals.
Wow, so we are one of the top 72 hospitals when it comes to Leapfrog.
Yep.
So Mike, you've got like a big, you know, it's a big deal. You're the new guy on the block, right? Your new Chief Operating Officer. So we've got to kind of sustain that A safety rating. Any thoughts on kind of what our plans are to make that happen in the future?
Well, first of all, it's great to be here. Thank you. And you know, it's exciting to come in and join a very experienced, successful team.
Right.
So that's the building block, right? It's the experience. The team's done it before, we'll do it in the future.
Right.
And really going forward, it's also going to be all about engaging the patient, engaging the family, and making sure that they come into the equation of trying to make us better. So a lot of that outreach is something we'll do going forward in 2017.
You know, that you make a really good point, because safety ratings and all those other scores are all great, but the fact of the matter is, you really don't have an engaged family who's helping you prevent those kinds of things from happening. It makes it much more difficult.
Absolutely. So
Right.
educating the family, educating the patient, and really also continuing to educate our own staff.
Right.
Because we can't stand still. The whole world is getting better, so we need to continue to get better ourselves as well.
Right. So that score keeps creeping up, right? Everybody's trying to get that A rating, and you know, we need to make sure that we stay on top of our game that way.
Absolutely.
So Brent, so some of the other initiatives that we worked on, we're a magnet hospital.
Yes, we're a magnet hospital, and that's a credential bestowed on nursing excellence. And although we say it's nursing excellence, it really involves the entire hospital.
Right.
We say the same for the safety culture, the safety score. You really have to have a culture of safety and a culture of excellence. And it cannot be part of the fabric of an institution. It has to be the fabric.
Right.
And that's the culture we've built.
Sure. And Mike, you've come from a variety of different organizations. You worked at some really big organizations within the area. Culturally, what do you think about what's going on at the medical center, and you know, how we might be able to make that even better?
Well, first of all, as you mentioned, I have 20-plus years of experience in this marketplace, primarily in New York City, and I worked in 3 outstanding academic medical centers, and frankly, none of them were a magnet hospital.
Oh, wow.
So being a magnet hospital allows us to attract the best and the brightest.
Right.
The folks come and apply for jobs at Jersey City Medical Center because we are the magnet hospital, and we have certain commitment to our team to educate them, to engage them, and to really provide the resources for them to be successful.
Right.
So really, that is what will continue going forward. Our accreditation for magnet, which we'll achieve, which we were planning to re-achieve for next year, is going to be, again, that building block towards success.
Right. You know, Magnet's a lot about empowering our employees, right? So really engaging them. You talked about patient engagement. Same thing with our employees, right? I mean, it's how do we engage and empower our employees to act for providing the best possible care?
Absolutely. And we have a series of councils that govern how we do business.
Right.
Our employees get as much information as we can provide to them. Jersey City Medical Center, and you mentioned that based on my experience, based on being elsewhere, is a very open, engaging organization.
Right.
We don't keep anything from our employees. They know as much information about our success and areas where we can do better as the administrative team.
Right. And so that's important to keep that communication, those lines of communications open, and really focusing on really getting those frontline employees engaged in that process.
Yes.
Right? The nursing staff, you know, any of the physicians, the medical staff, I mean, they all become, like you said, it's not just about a magnet designation for nursing, it's an organizational imperative that we really try to focus on. And empowering the employees, having that great teamwork with the physicians and the other staff, it becomes an integral part of what we do every day.
And as Michael say, we have a culture of inclusion.
Right.
We value, the employees are one of our truest assets, most valuable assets. And so we value their input. We involve them in all of the councils and all of the initiatives, and they can also see the success of their involvement.
Right. And I think that's what's most gratifying to me. You know, we really do value our employees and value the people that we take care of, and I think that comes through in our results. You know, like our A safety score, being one of only 72 hospitals in the country to be able to achieve that.
One of the things that we do that really makes us outstanding and unique is we survey our employees, we survey our faculty, our physicians, so they provide direct independent feedback on where we can do better.
Right.
And again, not every organization does that.
That's right. So we'll be right back. We're going to talk more about some of our plans for 2017.
It has actually changed my life. You know, it's wonderful to be in recovery. I'm also a grandpa, a great-grandpa. I found joy in being abstinent from use.
You know, I'm a family member, I'm a productive member of society, I'm a dog owner, things like that. I'm a fiance. So I think that recovery means on such a broad scale, there's so many different layers to what recovery means to me.
We're just like everyone else. We have heart and soul. It's just that we have this substance abuse disorder and that we're dealing with that. And if anything, it makes us a little bit stronger.
The most important thing for people in the community needs to know is that they're just like anyone else, and that they don't necessarily want to be doing the things that they're doing, and it's a chronic illness and it's a chronic disease that needs to be addressed as so.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back. We're talking about some of the accomplishments at Jersey City Medical Center and some of our plans for the future. Brenda and Michael are with me today. Brenda, so one of our major accomplishments was to achieve the Vision of Performance Excellence Award. Tell everybody what that means.
The Vision of Performance Excellence Award, we refer to it as VOPE, is a state-level designation of quality. It is the highest level quality award that can be administered using the Baldrige criteria.
Right.
You must achieve a state-level award in order to pursue the National Malcolm Baldrige Award,
Right.
which is the only award given by the President of the United States to an
So we're going to go
agency.
see Donald Trump, huh?
Well,
if we win the award?
Well, we will. Hopefully we
Okay.
will. And it's built on a set of criteria that organizations are evaluated on. You initially submit an application, and then depending on how well that application is written and received, you may get a site visit. We're a team of about 10 examiners come on site.
Right.
To make sure what you've put in that application is actually what the organization is doing.
So last year we won the Vision of Performance Excellence Award.
We did.
You know, one of the things I'm most proud of is that they mentioned how we value people.
Exactly,
Right.
exactly.
It's not just
That
our
was a key
employees,
thing.
right?
No, it's people.
Right.
And we do that, and it's evident even in some of the initiatives we have. We value the employees, and so we do an employee survey to assess their engagement. We value our physicians, and so we do a physician satisfaction survey. And we value our community, our patients,
Right.
and so we do a patient survey. And that was one of the key things that the examiners found when they did come on site for the visit. We have been on this journey now since 2008, 2009. But we still have work to do.
Mm-hmm.
We will continue on it and continue to implement best practices to make sure we are providing the best care at the right time to the right patient
Right.
all the time.
And really with that goal of being in the top 10%.
That's
actually.
right.
That's always what we've focused on. Right?
Yes, we have 4 pillars: patient safety, clinical quality, economic health, and engagement. And we focus all of our quality initiatives around those pillars and our mission of enhancing life and achieving the vision of top 10%.
Right. Great. Those are really, really great accolades that the Medical Center has achieved, and I'm sure with your leadership and the teamwork that we have, we will achieve the Baldrige Award. in
We're
2017,
hopeful.
right?
We're
Right.
hopeful.
So, Mike, one of the other things we do is a community needs assessment. And as a not-for-profit, we're required to do that. Can you tell everybody a little bit about what that means, right?
Well, every now and then, every 3 years or so, we have to go out into the community and assess the health status of the community. We have to measure the disease burden of the population. We have to measure population dynamics in terms of growth of various groupings, both age, gender, ethnic groups, and really try to get to the bottom of how can we do better in terms of the service. Jersey City Medical Center is an incredible resource to the community.
Right.
We're a trauma center. We're a very busy emergency room. We truly have outstanding service lines. We have Heart and Vascular Center. We have great Orthopedic Institute. We have wonderful women's health programs. But we know that Jersey City itself is growing and it's changing.
Right.
And we need to do the same. We need to do better in connecting the dots from the community into our specialties.
Right. And so that assessment is, we go out and we ask members of the community kind of what their healthcare issues are. I know that, for example, during our last assessment, we identified women's health as an issue, so we developed the Women's Health Center. We have some really strong product lines that support that community needs assessment also, right? I mean,
so we know, for example, that diabetes is a heavy burden in our community.
Right.
We know we need to provide better primary care. We know we need to provide better community engagement and education. And we also know that we need to provide better pathway from that community engagement and education into our specialties.
Right.
And again, if the need is there to provide additional services inside the hospital, we need to do better in terms of creating a pathway to where it's easy for the patients in the community to reach us.
Right.
So we'll continue to improve those pathways. We'll continue to improve how people can reach us and really go out to them and ask them, well, what's important to you and how easy it is for you to reach us.
Right. So, Brent, from our last community needs assessment, anything pop out in terms of some of our plans for the future?
Yeah, in the community health needs assessment that we did this year, we identified 5 major needs that we will be addressing or implementing some strategies around for 2017. And it involved, as Michael said, diabetes, overall chronic conditions.
Okay.
But diabetes carries, is linked to many chronic diseases, heart disease, high blood pressure, and so we focused on that. We've also focused on preventing disparities in healthcare. And disparities may be any number of variables. It might be related to race, it might be related to language, it might be related to ethnicity. But we want to provide the same level of service to all the various groups. Another need that was identified was the need for behavioral health, primarily focused around mental illness and substance abuse. And we have a very, very comprehensive behavioral health program that we're going to expand into the community and collaborate with some of the other agencies in the community to address. The community also identified their feelings of violence and unsafe neighborhoods. So we're also partnering with some of the high schools and the police department to identify some of those factors as well, so we can
So
begin
some strategies for really addressing some of that issue.
That's right, that's right.
So we'll be right back. We're going to talk more about some of our accomplishments and what our plans are for 2017.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just 1 path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want. Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Welcome back to the Medical Center, a year in review. I'm here with Brenda Hall, our Senior Vice President for Safety and Quality, and Michael Prilutsky, our Chief Operating Officer. Brenda, we were talking a little bit about our community needs assessment and two things that came out, two concrete things that came out from our last community needs assessment was the need for services in Greenville and our Women's Health Center.
Yes.
So at Greenville now we have a pretty comprehensive center there where people can get health care.
Yes.
That community.
The needs assessment that was done in 2013 focused on the community felt they needed better access to care. And so repurposing Greenville Hospital did allow us to bring some services back to the community and to provide for better access to care.
And so there's even a primary care, and they can make an appointment at that primary care center
Yes,
right there
they
in
can.
the Greenville facility.
In the Greenville.
And by the way, it's a beautiful brand new facility.
Oh, it's beautiful. You wouldn't recognize
it. Yeah,
the
it's
inside.
completely renovated. It really did a great job. Mike, then we have the Women's Center at Grove Street.
Of course, we have Women's Center at Grove Street. We also have Women's Center at the medical building right on campus.
Right.
Both beautiful facilities. And again, reaching out to the community. And we are getting younger as a community. We're growing as a community.
Right.
Lots of expecting moms and soon-to-be kids.
Right.
So the facilities are perfect for those families.
So you've been here for a couple of months, but we're already talking about some expansion plans.
Absolutely.
So talk about some of the things that we're really addressing as this community continues to grow.
Well, these are exciting times for Jersey City and Jersey City Medical Center.
Right.
And one of the reasons I'm frankly excited to be here is because of what's coming up in 2017 and beyond.
Right.
We're going to start major construction programs. We're going to start expanding our services.
Right.
We mentioned earlier the emergency room. Of course, it is busy.
Yeah.
We want to provide better service in our emergency room in terms of a customer experience. We talked about engagement earlier in this segment.
Right.
So we're going to start construction in the emergency room to make it brighter, bigger, and just friendlier to experience for all of the families that come through. We're also going to address what we mentioned earlier, which is our population getting, again, younger, having more kids. So we're going to expand our OBGYN services. We're going to build out more rooms for expectant moms to deliver in. They'll, again, will be brighter.
What's the big deal? What's everybody want?
There'll be private rooms. Everybody wants private rooms, and that's what we're going to invest in.
Right.
It is, again, a service to the community. We want to be that service going forward.
Right.
Of course, we'll also build on our strength. We mentioned earlier that our strength has been heart and vascular program. We're going to invest in that. We're going to put out more cardiologists, more offices, more diagnostic imaging to make sure that folks can reach the services that they require based on the community assessment we've done.
Well, even our cath labs, right?
Absolutely. Our cath labs are going to get remodeled. Our pre- and post-cath lab areas are going to get remodeled. Even our lobby is going to change going forward. So the whole experience is going to continue to improve. Part of Orthopedic Institute we mentioned, we're going to continue to bring on additional specialties, subspecialties in orthopedics.
Right.
We want to make sure that people don't have to go anywhere else from Jersey City. They can come to us and we'll cover all the needs for their orthopedic medicine. We're going to have rehab facilities. We're going to have a new outpatient facility for orthopedics and new physicians to service the population.
So as we kind of evolve the campus, I mean, we look at how many new residents, 60,000 new residents coming into Jersey City.
Right.
We're going to have to expand and be out in that community, right?
So one of the things that we know is changing in healthcare is transition from inpatient to outpatient services. Brenda mentioned community assessments, and really, frankly, the whole trends in the industry is to go outside, not in. So we're going to continue to expand our ambulatory services. We can continue to look to build out more on campus as well as in the community. open
Right.
more offices that are closer to the patients.
Yeah, I mean, we even talk about nutritional counseling, some of those things that we do to really be proactive. We have a navigator program through our population health.
Absolutely. The one thing that we would like to do is to continue to provide the 360 service to our patients.
Right.
It's not just enough for us, for them to come into the emergency room and leave. It's not just enough for us for them to come in admitted to our inpatient services and then leave. We want to reach out and touch them after they
Right.
leave our four walls. We want to make sure that they have the follow-up care, they have nutritional counseling, they have mental health counseling if necessary,
Yep.
they have social services because we partner with many agencies in the community.
Yeah.
So we do have programs, navigation programs, outreach programs that try to reach, call, and make appointments to every patient that comes through our emergency room as well as our inpatient service.
So, I recently went to a healthcare conference where they talked that healthcare should be more like Amazon. You go on one click and take care of all your healthcare needs. What do you think? Can we do that?
I think it's doable. It'll take some time.
Yeah, for
but
sure.
Just one thing to mention, we are investing in a new electronic medical record.
Right.
So we'll have a brand new EMR, electronic medical record, in June of 2017, which really will empower
Right.
these outreach efforts and will move us forward in trying to make this customer-friendly, access-easy environment for care.
Right. And what do you think about Bayonne? We have a brand new facility coming in Bayonne.
That's going to be outstanding. One of the community assessments that we've done was Bayonne, and how many folks come from Bayonne to our emergency room right here in Jersey
Right.
City. We're going to go out to them. We're going to open a freestanding emergency room. It's going to be a full-blown 911 center.
Right.
It's going to have full imaging, and then we'll also put physician offices in that building so the follow-up is easier.
Right.
But the folks from Bayonne will get their care, the quality and safety of Jersey City Medical Center within their community.
Right. And, oh, by the way, we'll accept insurance.
Absolutely.
Right? That's a big deal for our friends in Bayonne,
We mentioned
right?
earlier that Jersey City Medical Center is a resource for the community.
Right.
And the underlying fact is that we take everyone.
Yeah. And we accept all their insurances, and sometimes they have trouble in some of these communities.
Absolutely.
If you were to look kind of 5 years into the future, what do you kind of see for healthcare?
Well, I think the trends that we talked about will continue.
Right.
Transparency into safety and quality.
Right.
As much as patients demand ease of access, they also demand to know if they're getting what they deserve, what
Right.
they expect. So that will continue. We'll have to improve how we report out the communities in terms of our services. Of course, the trend to ambulatory will continue as
Right.
well. Many procedures done now in hospital will be done on an outpatient basis.
Right.
So we will, as Jersey City Medical Center, as Barnabas, Robert Wood Johnson Barnabas Health, we will continue to invest in outpatient facilities.
Right.
We'll see more ambulatory care centers, ambulatory surgery centers. We'll see more medical buildings out there.
Right.
And certainly we'll see a push into quality of care outside the medical center in terms of prevention. We
Right.
talked about those counseling sessions.
So, exciting times in healthcare.
Absolutely.
We have lots to look forward to. Of course, we're rooted in the community. We always want to make sure that we're providing those services for our community. And so it's an exciting time. I can't thank both of you enough for your support of the medical center and the great work that you do. And this has been a year in review, and we'll be back another time to talk more about healthcare issues in Jersey City and Hudson County. Have a great new year, everybody.